Yesterday we received 6 patients, burns victims at around 11:30 p.m. in the night, brought by the Coast Guard. They were actually rescued from the Coast Guard. They were on the ship, on the vessel. They were not jumped into water as it was reported. They were all in the vessel and they were rescued by the lifeboat. Out of 6, 2 are critically burned. One is 40%, another one is 30%. 40%, one is a 47-year male. He is a Chinese national, he is an engineer. And he mainly sustains burns in the face, upper limb and lower limb. They both have airway burns. That is much more serious. Airway burns is one thing which is likely to worsen over next few hours or few days, because the airway becomes tight and then the breathing becomes wrong. So that these things are to be looked after. And they also have deep burns. So they will probably require some surgical procedure later. Right now they are stable, they are conscious, they are able to speak, and they are able to take some liquids also, and their vitals are okay. Both of us stable now. Their urine output and blood pressure and heart rate, everything is normal. But they are intensely monitored in the ICU. They are on. Other 4 people, one is in observation room. He is having facial burns, deep facial burns, but he is conscious, oriented, and is taking orally. And other 3 are okay. They are quite cheerful. They don't have much burn injuries, but there are some impacts. Not only burns, there is some impact also. Some have some cut injuries, some have some ear laceration, tooth loss, and all that. So that. No, none of them. They were not jumped. They didn't jump into water. They were all rescued from the vessel on the board. They were all in the board, and they were rescued from the lifeboats from the Coast Guards. No, there is a leak of chemical substance also, because one of them said he touched the some liquid which was flowing out, and he sustained burns. But there is minor burns, and there is not much of some liquid. Yeah, the hot. But most of them had an explosion, which is hot fumes, and then the blast itself is caused some mechanical injury.
Internal organs damage?
No, there is no internal organs. Superficial cuts are there, some teeth loss and all that.
Organs?
Respiratory burns are there, like they have upper respiratory airway burns. So that is one thing which we need to wait and see.
How any plastic surgery like that?
Immediately no, but we'll see how their condition. We will be monitoring them intensively, because anything which is above 20% is a major burns, and they have a risk of life in terms of sepsis and then wound problems and other things. So we will be monitoring their burn wounds, and then the hemodynamic stability, and their nutrition, and a lot of other things which are important.
Someone was injured from the chemical burn.
No, he is not that injured. He touched the thing, but he had that redness in the hand, but he is okay.
Since it's a chemical, there is any other procedure or something after that?
No, nothing. It was just washed and it was okay. Yeah. But we don't know what actually the chemical was. All of them are conscious.
Is they able to speak there?
Yeah, to media to.
No.
Huh? Yeah, they are speaking. They are communicable.
All are overcome the
critical stage.
Yeah, they are.
Two of them overcome critical stage.
See, the critical stage in burns is not the one-time event. It is once we have to wait for next 72 hours to 1 week, and then see, because the most important in burns is about the sepsis, and once the skin damage, then the risk of infection and risk of sepsis is higher, and especially in airway burns, when the breathing pattern may become difficult, because both are on oxygen support right now. So we have to continue and then cease. Some might actually end up in some ventilation also. So that's thing which need to be taken care.
They are in ICU?
Yeah.
All of them or only
2 are in ICU, one is in high dependency unit, others are in the room actually.
Have you been in touch with anyone from their home countries or something like that?
No, they have been supported by their agents, and then the insurance companies, and they are not a problem actually. Yeah.
And how long do you think they have to be kept in the ICU?
2 have to be kept for a longer period, because they needs to be monitored, because probably 2 to 3 weeks they may require to, even if it is some part of superficial burns. But some are having a deep burn, so that will require a longer treatment.
So the main problem is that they have burn in their airways.
Airway, and of course the other parts of the bodies also. So that itself is, the extent of burns is more than 20%. So more than 20% is serious burns anyway. Yeah.